Thank you so much for joining us for another wellness webinar series event with Jefferson Health. My name is Sarah Breckville, and I will be serving as the program facilitator and will present your questions to our panel of experts. Tonight, our experts will provide an overview and demo of the features of the patient portal, MyJeffersonHealth, which is conveniently available to patients at any time of the day. This will be an opportunity to learn how to get started using this platform or brush up on the knowledge of some of the newer features. Well, thank you so much for submitting your questions in advance of tonight. And the questions that you'll hear me asking the panelists are all submitted right from when you registered for this webinar. If you have any questions throughout our discussion, for those joining us on your computer or tablet, at the bottom of your screen, you should see an icon that says Q&A. Well, we'll do our very best to get to as many questions as possible, but may not be able to answer all of them during this virtual event. And due to hospital, university guidelines and privacy, we are unable to comment on specific cases. Likewise, if you are experiencing any symptoms that may require immediate medical attention, please consult a medical professional. Okay, well, without further ado, I want to go ahead and introduce our experts for the evening, starting with Katie Deshane, our EPIC director, and Dr. Bracken Babula, medical information officer. Well, thank you so much for joining us. And if you each want to go ahead and just take a few minutes to introduce yourselves to the audience, that would be great. Katie, we'll go ahead and start with you.
Sure. Hi, everyone. I'm Katie Deshane. I'm one of our senior directors here at Jefferson, and I oversee our team that manages the patient portal, MyJeffersonHealth.
Great. Well, thank you so much. We're looking forward to our discussion tonight. And Dr. Babula, how about yourself? Welcome to our webinar.
Hi, everybody. Good evening. Thank you for joining us this evening. My name is Bracken Babula, and I'm an internal medicine primary care physician and also one of our medical information officers, which means I'm one of the physicians who helps connect the other physicians to our EPIC and IT teams.
Perfect. Well, let's go ahead and dive into the questions. I know that we've received a lot of them already, so we'll go ahead and get started. Dr. Babula, we'll start with you. Can you give us a brief overview of what MyJeffersonHealth is?
Yeah, absolutely. So we're going to show you a lot of features this evening, but very high level, MyJeffersonHealth is our patient portal, which is the patient-facing version of our electronic medical records. So a lot of the tools that your physician or nurse practitioner uses to document in the EHR in the office or in the hospital or in the ER is going to be the same information that gets conveyed to you through the patient portal. So it's a place that you can go and you can access a lot of your medical records. Almost all of your medical records are available there. It's a place where you can update many of those aspects of the medical records and review information, learn more about your health conditions, look up your history, various things like that. And it's also a tool that allows you to schedule appointments and interact with your care team. So it allows you to send messages as well. And we're going to show you a lot of those features. MyJeffersonHealth is the Jefferson Health version of a tool that you've often heard referred to as MyChart. You may often hear the terms MyChart and MyJeffersonHealth used kind of interchangeably. You may even hear us do that this evening. If you have a provider that exists in another institution that is using the electronic health record, which is known as EPIC, you will probably have another MyChart available. And what you may find is that there can be a lot of similarities in the features because they are all designed by EPIC, but there can be differences across the features that are available depending on the institution and how they've configured it. But either way, if you have a login to one version of MyChart, you will be able to connect them with others so that you can easily cross back and forth between various versions of your chart across the various institutions where you see your doctors. So you'll hear us talk about MyJeffersonHealth you may be a little confused as to how that relates to MyChart. MyChart is the backbone for MyJeffersonHealth, and MyJeffersonHealth is the branded version that we have of it. So looking forward to showing you many of the features this evening.
Absolutely. Well, thank you so much for that helpful overview. Okay, Katie, we will turn it to you. A question for you here. How can patients schedule or reschedule appointments or find new providers?
Thanks, Sarah. So I'm actually going to log in to our test system so that I can show you real time how to do that.
Perfect.
All right. So Sarah, can you just confirm that you can see my screen?
Yep, all looks good to me.
All right, so this screen probably looks familiar to you. If you currently have a MyJeffersonHealth account, this is our homepage. This is our test system, so that's why you see this yellow bar up here. It's just a warning so that we remember that we're in our test system, and I'm going to log in as a test patient. And MyChart Luke, he is our test patient, so he's going to have a very established MyChart. You'll be able to see a lot of information about him. But I'm going to actually focus right now on scheduling, and probably the easiest way to schedule visits is to actually go to this visits button up here at the top toolbar, and then click the schedule appointment button. And there's a few different ways to schedule appointments in MyJeffersonHealth. You're probably familiar with it if you use the system, but I'm going to go to this hub so that I can show you a few different ways that you can schedule. So first and foremost, I'll just focus on down here because I know we had a lot of questions about this, and this is how do I schedule with a specific provider. So if you have established care with a provider, so you've seen that provider within the last 2 years, you will see their name here. And so here I can see that MyChart Luke actually sees Dr. Babula, and he needs to schedule a follow-up visit. So we're going to go ahead and schedule that. It defaulted in Dr. Babula's location because he only sees patients at one location. A lot of our physicians do see patients at multiple locations. So if that was the case, you'd have to choose which location, and then you're presented with the time. Dr. Babula is a particularly great physician and has an open schedule for us. So you can go ahead and select a time to visit for that visit and go ahead and schedule it. And so I want to say that I'm going to come in tomorrow for a sore throat. And so that will go ahead and complete that visit. And you can see here, this is a visit for the next day. So I'm presented with some different options so I can confirm it if I don't want to get a phone call. I'm going to talk about e-check-in in a little bit, or I can pay my copay. But we know that you're not always seeing providers that you've seen before. So you might want to schedule with a brand new provider. And so for those, you have this find a new provider button. Here, you're brought to what specialty you're looking for. So we have all of our various specialties listed out here. You could go and schedule an appointment with dermatology, your new patient visit, and you want to come in for your psoriasis. So you can see here, I had selected, I kind of blew through it, our Delaware location, which is our newer location. So we have a lot of availability there. So you can, again, kind of take those same steps and select those appointments. And again, that's if you're scheduling with a brand new provider you've never seen before. And then the third option that we have for scheduling is relatively new. And this is what we have, they're called our scheduling tickets, and your provider might talk to you about that. But that is if your provider places a specific order or referral, you will now have the option to schedule it. So we have this live for most of our radiology locations. We're working on MRI right now. That should be done by the end of the year, but everything else you should be able to schedule. So if your doctor puts an order in, and I'll go through that in a second. If your physician places the referral order, so this one was a referral to GI, you'd be able to schedule with a GI provider for the issue that your provider wants you to go and see. And then sometimes your provider might schedule, their office might send you a scheduling ticket to come in for a new appointment. We often see this if you're with our population health team or you're being discharged from the hospital. We'll send you a ticket to kind of remind you to go and schedule either a new patient appointment or a follow-up appointment. But for today, I'm just going to show you how to schedule and with one of our radiology visits, because I know we got a lot of questions about those. This particular one is for an x-ray. So you get asked a couple questions. A lot of these are they actually are the exact same questions that you'd be asked if you called in to our call center. They're just showing up here. And then there's also a disclaimer that, you need to make sure you understand your insurance limits, that you're not supposed to go somewhere else and that you're good to come here to Jefferson. And once I fill out all those questions, I can select the location. I live in New Jersey, so I'm going to go ahead and select the New Jersey locations. I want to see where's first available. I can actually go tomorrow. So I'm going to go ahead and schedule that tomorrow. And now the radiology department knows that I am ready for my visit. And then the last thing related to scheduling that we're going to talk about tonight is just e-check-in. And so e-check-in is our electronic check-in. And this is really to speed up the time that you're at the front desk. So you'll get a reminder 3 days before your visit to complete your e-check-in. Oops, I clicked the wrong button. Sorry. Test system. What can I say? This is, how things go. Let me go back to my homepage. And so when you complete your e-check-in, this is just going, oh, there it is. It's because I scheduled that appointment with Dr. Babula earlier. This is just going to walk you through what the registration would typically ask you. So you're going to enter your insurance information, any allergies. I don't have any allergies on file. Any medications, if there's any new ones, you can also add them. It's also really important that you select your default pharmacy so that when you go in for your visit, if you need to have prescriptions placed, they place them there. You can pay your copay at this point, or you can pay later. I'm going to pay later. If you have a balance, you can also pay that there or pay that later. If you have a trip out of the country, you can put that on there. And then if you have any questionnaires related to your visit, you can also fill those out at this point. I have not tested for positive for COVID. All right. And now I'm good to go. So when I arrive at the front desk, it will just be letting them know that I've arrived, and they will have all the information they need to let the staff know that I'm ready to be seen.
Terrific. Thank you so much for that helpful overview. I think that's really great for the audience to see. So thank you, Katie. And a follow-up question. There is a newer feature I know called the Symptom Tracker. Could you talk a little bit more about that feature?
Yeah, absolutely. So we at Jefferson have partnered with a company called Ada, and they're a leader actually in kind of symptom tracking. And what this is, if you're not really sure if you should be coming in for a visit, or, should I wait to see my primary care doctor, or should I go to urgent care, or should I go to the emergency room, and you're looking for that guidance, we have that tool available. So here's your menu. We'll talk about the menu a little bit more later, but in general, this is where you can find all the different features available in MyJeffersonHealth. And at the bottom, we actually have the Symptom Tracker. I'll launch into that. And so from within here, you do stay within MyJeffersonHealth. I'm not going to go through a whole visit right now, just so that we have plenty of time to talk about all the different things. But here you would talk or chat with the symptom tracker, talk about your symptoms, how long you've been having them. And then this will guide you through acuity scoring, which basically is how severe is your case, and then give you that guidance of, do you need to schedule with your doctor, or go to urgent care, or go to the emergency room. Or schedule an on-demand telehealth visit. And so this is a great tool if you're not really sure what the next step that you should be taking is.
Absolutely. Definitely a helpful feature. Thank you. Okay. Dr. Bibble, we'll turn to you. Can you talk a little bit about how can a patient review past visit notes and even review their test results?
Yeah, absolutely. So Katie's going to continue to show you some things here, and I'm going to talk as she is scrolling through. So What she did was click on the visits button at the top, the same place that you could go to schedule appointments. But instead of scheduling into an upcoming appointment, she scrolled down until she got to the past visits. Now, again, this is a test patient, so there might be a lot of kind of noise in here. But what you can see when you do this is you see all of your past appointments with all of the different providers that you've seen. And you can see whether it was an office visit or a telemedicine visit or some kind of other interaction with that provider. And you have two links that you can click on. So one of them says view notes and the other one says view after visit summary. So Katie's going to first click on view after visit summary. So I'm sure if you've been to a Jefferson doctor a few times, you have seen these, or they've been printed out for you, and you can, they're often quite long. We recently made a change in our system actually to stop printing these out by default, and so you will find these when you request them. You can always ask to have one printed, but by default, it's always going to be available to you in MyJeffersonHealth. And so this is what it looks like. This one happens to be 8 pages long. So there is a lot of information that you can kind of scroll through here if you're interested in learning about the specific visit that you have. You'll find oftentimes the most important and relevant information is right at the top. So right at the top is where you're going to find instructions that were provided by your doctor. So if they type something into their side of the system that says, adjust your med or do this, that, or the other, that will show up in instructions. So it's really important that you follow those. You'll also find information about your visit. So you'll see a diagnosis associated with the visit. You'll see vitals associated with the visit. And then below that, you'll see information on what's coming up next. So you may see things on here that say, Dr. Babula ordered an x-ray and I need to schedule that, or I ordered some labs for you and you need to schedule that, or you will see your upcoming appointments that are already scheduled for you. So the after visit summary is a really helpful summary of everything that your doctor went through with you. It also shows some things like recommended care, outpatient care teams. A lot of this information is already in MyChart, but it's kind of combined together into one area that you could quickly review. I'd also note here that there's a link that you can click on that has some information about community resources. So if you're looking for help related to things like transportation, or help with other things in your community, you can click on those links and you can find some additional help provided with some partners from Jefferson. And then if you scroll all the way to the bottom, I don't know if it's on here, you'll often find longer attachments that include updates about your medications and other kinds of attached information, such as this one, which is a few pages about a cough, which might recommend things that you should do or should not do and when to contact your doctor as well. So really helpful information on the after visit summary, and I would encourage you to review that after you finish your visit. And Katie's going to talk about notifications later on, but one of the things is if you have notifications set up on your phone or your email or your computer, you should actually get a notification that tells you that your after visit summary is ready. The second one is notes. And so you can get to it by clicking on this tab on this page, or you can click on the view notes page on the visits as well. This is the actual note that your doctor wrote. And so a lot of you may not be familiar that this exists, but all of the notes that your doctors write now are now shared to you as soon as they sign their charts. So depending on how quickly those charts are signed, it may be available to you right after the visit, or it may take a few days if they're a little behind on charts. But once they sign that note, it will become available to you. And what you'll actually see is the actual note that the doctor wrote, which will include your history of that you talked to them about. It'll include oftentimes a section on vitals and physical exam, assessment and plan, etc. The doctors are aware that this is shared with you, but this is really designed to be kind of the formal medical documentation. And so you may often find information in here that is not necessarily clear or written in a way that you understand. It's really designed to be for the doctor to understand and for the doctor to communicate with other doctors as well. But this is very helpful, and these become available in real time as soon as they sign this. And this is a new requirement. And if you haven't heard of it, there's something called the 21st Century Cures Act, which came out a few years ago, which now requires all of your doctors, regardless of which institution they work in, to share your notes in real time. And so that's why you may have never previously seen these notes in previous years, but are seeing them now available to you as well. So that is how you can quickly review your after visit summary and the notes for your visit.
Great. Well, thank you. And I'm sure that's a surprise to many people that they have access to view those notes. So thanks for walking us through that. Yeah.
And then I was going to talk about test results. I forgot there was a second part of the question.
Perfect. Thank you,
Katie. Thank you, Katie, for paying attention here. So test results show up on a separate tab. So when you click on the test results tab, you will see them here. Now, again, this is a test patient. So all of the data that you see here is fake. So it's not exactly the same. But you could click on one of these results and you can see, where the result is, what range it's in. You can click on the view trends button at the top, which will actually, if there's data to be trended, will show you a trend of that data over time in a graph form as well. There's additional buttons that you can click. There's a learn more button. There's additional information that'll tell you the lab and the authorizing provider and all kinds of other information like that. So you can really learn all about your results through this. You can see lab results, you can see your imaging results, you can see, ultrasounds, and all different kinds of results will be available to you here. And depending on the result, you may see different information. So if you're looking at imaging results, you might actually see pictures, which I think is always interesting, because sometimes my patients come into the office and they go, "Oh, I saw that picture of my elbow x-ray." And I'm like, "Oh, you mean you read the report?" And they were like, no, I actually saw the picture. So I think a lot of my patients find that really interesting, to be able to, physically see some of the pictures out of their MRI or their CAT scan or things like that, in addition to being able to see their lab results as well. So this is a really helpful tool. Now, I did see that there was one question that was brought up about when the results become available. So I mentioned just a minute ago about the 21st Century Cures Act. One of the new other requirements for the 21st Century Cures Act is that all results must be released to you immediately, as soon as they are finalized. And that could be 3 o'clock in the morning on a Sunday. That could be, during a work day. It doesn't matter. Whenever the result is finalized in the lab or by the radiologist or whoever is finalizing the result, as soon as it is finalized in our system, it is going straight to you. Now, and if you have notifications set up, that also means you're going to get notifications that pop up that say your result is ready. Now, this is a change for a lot of people. It used to be your results would get released within 1 day or 2 days or something like that, or your results would get released by your doctor as they were reviewing them. So the doctor might see it first. If something was really concerning, they might call you first before releasing it to see it. No, that is no longer the case. Now you see the results at the exact same time as they are released to your doctor. Now, keep in mind, most of your doctors are working during the week, right? So most of us are working business hours, Monday through Friday. And, unless you're in the hospital, then you might be working nights and weekends. And so even though you receive the results at 3 o'clock in the morning on Saturday or something like that, we may not actually see it until Monday or another day when we're back in the office. And so I think there was a question here about what is the reasonable turnaround time. So it can take sometimes a couple of days for us to get through these results, depending on how many results were received and depending on the abnormality of the results, right? If there's something really scary in your results, we're more likely to call you really quickly versus something that is mostly normal. You may hear from your doctor later on. Now, you might get a phone call, you might get a message in MyChart with it, you might get you might actually see the result come through with a comment on it, or something like that. So keep that in mind as well, because I know this is something that certainly can cause a lot of concerns when these results are released to you immediately.
Okay, thank you. And thank you for addressing the timing there as well. We appreciate it.
Yeah.
All right. So the next question for you, Dr. Babula, a question we have been receiving is how to send a message to providers and request a refill.
Absolutely. So there's definitely there's a few different ways to do this. And actually, if you go back to the homepage for me, Katie,
Yep.
One of the first things to notice is that on the right side of the homepage, as soon as you log in, you should actually be able to see your care team and the recent providers that you have seen. And you have a calendar button there so you can book an appointment with them. And you have a little envelope icon, which would actually send a message. So this is probably the easiest way to send a message to one of us. Is just to click right on that envelope icon. You can also click on the inbox at the top, which will launch into your existing messages in your inbox. So either way, it will get you to the same place. So when you go into the inbox, there's a button that says send a message. You click on that. It's going to ask you which of your My Charts you want to send the message to. So that's an important kind of part here. So you're seeing two different versions of our test system here. But if you did have other institutions that you were logged into, you may see multiple versions of the institution. So just make sure you pick the right institution, right hospital system that you want to be sending the message to for your doctor. So we're obviously going to pick the first one for Jefferson. And then from there, you're going to see 5 choices, at least. And it's important to understand that even though you said send a message, MyJeffersonHealth is giving you other options in addition to sending a message. And so some people are thinking, oh, I need to schedule an appointment. I'm going to send a message. Well, you don't have to send a message. You can just click the schedule an appointment button. Some people might think, oh, I need to send a message in order to request a refill. Well, you don't necessarily need to send a message. You can actually electronically request that refill by clicking on the refill a medication button. And when you click on that, it'll actually present you with a list of your medications, and you can click refills of each of your medications as well. The third one down, ask a medical question, is a way to send a message to your doctor's care team. You can also start a video visit. Or if you have a customer service related question, such as trouble with MyJeffersonHealth or some other kind of like customer service, billing, insurance information like that, you can click the last one. But most of the time when you're looking to send a message, you're looking for the third one, which is to ask a medical question. When you click on this, you're going to get an alert here. And there's a couple of things that this alert is going to say to you. So the first one, obviously, is that if you need immediate medical attention, you should dial 911 or seek medical help from the nearest hospital or emergency treatment center. And this is really important because these messages are not reviewed in real time. In fact, the next line down explains that these messages can take up to 3 to 5 business days to receive a response. Much in the same way that there may be a delay to receive your test results, sometimes there can be a delay to get a response back for this. So this should not be used for something when you need a very urgent request. Another thing to understand about these messages, which I think is often confusing to people, is you might have clicked on my name to send me a message, and you thought this was coming straight to me. But in fact, all of our messages are initially reviewed by our clinical staff during regular business hours. And the reason for this is because oftentimes our doctors are seeing patients all day long, and our clinical staff are the ones that are actually in front of the computer handling messages. And so in many cases, your question, whether it's an appointment or a refill or something like that, might actually be able to be answered by the clinical staff first. If it's a more complex clinical question, they might send it to a nurse before eventually sending it on to a doctor. So that's important. It's also important that if you are sending a medication-related question that you reference your pharmacy in there. And if you're sending a lab-related question, you mention if you plan to use LabCorp request for your lab as well.
Okay, well, thank you again.
Yep, sorry, just real quick. And then you select your medical question. It could be non-urgent, test results, visit, follow-up question. Then you select the person. There you go. And this is how you send your message. And so, you don't need to put much into the subject line. You can put the bulk of your question into the inside of the question there. And then you can send it off. If you need to send an attachment, you can do so. So if there's a form or a photo or something like that you need to send along with your message, you can absolutely do so. And it's important to provide any of the information that you think your care team will need to be able to answer this question.
Perfect. Thank you. And thanks for showing us how to do that message there. Okay. We're going to change conversation a little bit here and talk about paying bills. So Katie, question for you. Can someone pay a medical bill through the portal?
Yes. So when I showed e-check-in quickly earlier, you did see that you could pay both your copay and if you have a statement. So if you have an upcoming visit, I highly encourage you to pay your copay, pay your statement that way, so that you don't have to do that when you're at the front desk. But that is one option. You always have the options to pay it from, when you get your notice. So here you can see on the homepage, if you have a statement balance, it will show here. And you can pay now right here from the homepage. I will also show you how to navigate. If you're in the menu, you can actually see some additional information about your billing account. So I'm going to go to my billing account summary, just because I want to know a little bit more. I owe $189.99. And I can pay that balance now. So you can either pay the full amount or you can pay, $5 of it today. We do, similar to like how most of your online shopping probably works this day, the first time you enter a credit card, you have the option for it to be saved. You can save it and you do it to validate the security code. I'm not actually going to go through that right now, but you do have that option to pay your bill right there online. And I know Bracken brought this up and we'll talk about it in a little bit, but communication preferences. Right now, we are by default a paperless billing institution. So you will not receive a paper bill for your first statement. If you have a MyChart account, you will receive that via a notification, either to your email or to like a push notification on your phone, depending on how you have that set up. But your statements are available online if you had one. And you can always opt out of paperless billing from that page as well.
Hey, well, thank you. And I know this is helpful. Again, this live demo for people to be able to walk through. So Katie, I'm wondering, what are some other features that you think may be beneficial for patients to know how to use? And could you just detail those for us?
Yeah, so I think there's a couple of things. One, just in general, this search menu is incredibly beneficial. If you're not sure where to find something, if your provider said they sent you a letter, you can search for letters and it will take you to the letter activity. If you need to print out your immunization record, you can just search for immunizations and it'll bring you to that record. So if you're ever not sure where to look, I would say definitely start here with this search bar, and that's going to be something that's super helpful. The other thing that I wanted to talk about is kind of down here at the bottom, and these are two things. So first I'm going to hop into what we call the sharing hub. And the sharing hub is really important if you need to share your information with someone else. And so there's a few different versions of that. So one, you can grant proxy access. You may have heard that term if you're in the office. And this is if you have children that are being seen by Jefferson Health and you're the parent and you want to have access to their account when you're in the office, you can ask them to link your accounts by proxy access. I have 3 children. I have proxy access to all of their accounts, both at Jefferson and SHOP. So, I can see all of their information. And so that's one way that you can grant that here. Also, you have this ability, I'm going to scroll down a little bit, to grant one-time access with Share Everywhere. This is a great tool if you're seeing a new provider or going for a consult outside of the Jefferson Health system, and you want your doctor to be able to see your visit, but maybe just have it for that initial consult. You can give them access one time with the Share Everywhere code, and this will generate the code in the website and provide that to that provider. So that's another great way. But in general, if you need to share your record, request a formal copy, manage who can see your account from that proxy access, you can do all of that from the sharing hub. Another really valuable tool that we talked a lot about in this one is really your communication preferences and your personalization. As we've showed just very briefly, there is a lot you can do with the patient portal, and you might want to receive different notifications different ways, and you actually have the ability to control and customize that. So we have the ability to send information via text messaging, via email, via push notifications on your phone. If you have your app set up if you have the app downloaded, you have that set up. And you actually have the ability to kind of control to what level you get that information. So if you would rather receive text messages because you just are constantly viewing your text messages, or like you're like me and you have a watch and the text messages pop up on there, that's a great thing to kind of look through your communication preferences to make sure you're receiving the information in the way that you want to receive it.
Yeah, and Katie, I just want to really emphasize this to everybody, and I would encourage you and your friends and family to go into My Jefferson Health and update this. I think we all are kind of inundated at times with messages and emails and things like that. We get a lot of spam out there, and I think a lot of us have kind of have this reflex where we want to just unsubscribe from everything and not get notified of anything. But then what we don't realize is that means we don't know that our doctor sent us a MyChart message back, or we don't know that our X-ray result came back, or things like that. And so it doesn't necessarily have to be text messages if you don't want. It could be email, or it could be push notifications or things like that. But you really should walk through this and make sure you're getting some kind of a notification of this information, because I can tell you, as a physician who receives a lot of results for my patients, I'm often, writing a comment back to those patients about their result. Your cholesterol is a little bit high, but I'm not super worried about it, and we're going to keep an eye on it, and let's repeat it in 6 months. You're only going to see my comment if you either log into My Jefferson Health and look for it, or if you have notifications set up so that you receive those notifications. So I think it's just really important to have some mechanism of being notified when some of your important health information is passed along to you.
Thanks, Bracken. And then quickly, just two other things I wanted to point out actually live outside of My Jefferson Health and on the login page. And that's first and foremost, language preferences. So right now we do have My Jefferson Health available in Spanish. By the end of the year, we will actually have 3 additional languages available. So we're working on expanding this so that if English is not your first language, or you're working, or you have a loved one where English is not their first language, that this will be available in additional languages. The other thing is this, we have a website that lives outside of My Jefferson Health that really goes over a lot of the education for these different features. So if we didn't talk about a feature tonight, or you want to learn a little bit more, if you just go to the homepage and click on this link here, we call this our patient education website. And there's a video about what My Jefferson Health can do. And then we actually have links to more in-depth information here. So if you want to learn more, we do have this webpage available for you to learn more as well.
Yes, certainly a helpful webpage there. So thank you. Okay, and Dr. Bibble, I know you jumped in earlier, but just curious to hear, what do you think are the most important benefits of the portal?
Yeah, absolutely. So, as a primary care physician, I really appreciate that so many of my patients can be so educated and engaged about their own health. And I often have my patients come in to see me, and they joke that they looked up something in Google and like how terrible that is. And honestly, it's not. Like, I appreciate that my patients are reading their results, and they're Googling it, and they're reading my notes and looking information up, because I really, I have a limited amount of time that I can spend with you in the office visit itself, right? It's a busy day. There's a lot of patients backed up. Sometimes I'm running behind, and I feel really bad about that. And so I love that my patients can go to My Jefferson Health. They can read my entire note. They can, see all of the results that I ordered for them, and get an opportunity to kind of read all about that information beyond the time that I'm able to spend with them directly in the office. So it's a really important tool to help you better understand your healthcare, and also to be able to more quickly and easily interact with your care team, whether that means scheduling appointments, whether that means scheduling other kind of tests, whether that means, sending messages or paying your bills or other things that you need to do with the system. It really just allows you to to interact best with our system. And it allows you to do it during your own time, right? Like if you're someone who likes to request your refills for your prescriptions at 3 o'clock in the morning, you absolutely can do that. Because that message is going to come to me at Monday morning at 8 a.m. and I'm going to be able to fill it for you then. So it allows you to learn about your health, interact with your care team, get the things done that you need to do, on your own time, on your own schedule. I'm someone who, orders a lot of my food through apps on my phone and, requests my, Uber through apps and does a lot of those kind of things. And so my Jefferson Health is really kind of the healthcare equivalent to that. And I can tell you, as a patient, I use it as well. And I think Katie would say the same. And we use it as well. And I like that I get my notifications in real time of my results when my doctor orders something for it. And I like that I can go in and request refills for my own medications or with proxy access for my family's medications and things like that. So, I use it as a patient. I use it. I know my patients use it as well. And I just think it's a really great tool to improve our healthcare for everybody.
Absolutely. And again, as you said, really being engaged in your own health at your own time, which is huge and it makes things a little bit easier. So thank you. Okay, well, I know that we've received a few live questions from the audience, so we'll go ahead and as we wrap up, we'll just answer these questions. So Katie, question for you. This person is wondering, the scheduling feature within MyJefferson Health is just for scheduling with Jefferson Health physicians, right? This function cannot be used to schedule with physicians at outside institutions, correct?
That's correct. I would say though, we did talk a little bit about linking your MyChart accounts. So if you see providers at Penn or Cooper, Virtual at Temple, in the area, I would encourage you to link your MyChart accounts and there's instructions how to do that on our patient education webpage. Because then when you're in there, if you need to schedule a visit with Bracken because he's at Jefferson, but you also have an appointment or a physician at Penn that you want to schedule an appointment with, you could do it both from a single login.
And I would add too that, our phone staff that are available at the 1-800-JEFF-NOW number are also able to assist you in scheduling with anybody that you can't schedule through MyJefferson Health. So for example, if you're looking to see a doctor at Jefferson Einstein, they can assist with that, or even one of the affiliated physicians practices that are not using this portal, they can actually help you as well. So they can't help you schedule at other hospitals outside of the Jefferson network, but if there's any Jefferson groups that that are affiliated with Jefferson, but you can't find them on the MyJefferson Health website, you can use 1-800-JEFF-NOW to speak to someone who can help you schedule those.
Perfect. Thank you both. Okay, next question for you, Dr. Babula. Can I have my records, test results sent through MyJefferson Health to another physician? Can I request my records through MyJefferson Health?
Yeah, that's a great question. So Katie, can you log back in and show that sharing page again?
Yep.
So I think there's a few options. So you can show the sharing page while you're loading that. I'll just say, obviously, you can always take a result that is available in MyJefferson Health, and you can print it, or you can print it to PDF, and then you can share it with something. And that happens all the time. My patients come in and they walk in with a piece of paper, and they're like, "Here's my result," and I can tell that these were clearly printed from MyJefferson Health. So that's always an option for you. But Katie will show some of the other features here if you want to do the more formal sharing option.
Yeah, I think the share everywhere is a great option for that. So this is that one-time access. If you want to send it to someone, this is the requesting the share code. And again, there's a little video here. So if you want, a specific provider to have that one-time access to see your test results and any medications that were prescribed, share everywhere is definitely the way to go. I think part of that question was requesting a formal copy of your health record. So if you need to have a formal copy of your health record for a variety of reasons. Sometimes workers' comps need it, sometimes lawsuits need it, sometimes you're starting a new job, they need information. You can also do that here, request a formal copy. That is not instantaneous. I will say that request goes to our health information management department and they review it and then they'll release the record to you. So you can do that as well. And then I do believe Bracken just mentioned that, a lot of times patients print out their test results. You have the ability to always do that. Show your test results and print them out. When you click on it, there's a little print button. You can go ahead and do that as well.
Hey, well, thank you. All right, another question for you, Dr. Bubula. How can I get in touch with my doctor with an urgent question? Should I message them through My Jefferson Health? I know that you touched on this earlier, so do you mind just elaborating on this?
Yeah, absolutely. So I would not recommend messaging as the mechanism to get in touch with someone urgently. As I mentioned, it can take some time for them to get back to you, depending on the office, depending on the volume of messages they're receiving, and things like that. It can definitely take some time to get back to you. And again, they do not address these messages on nights and weekends either. So the best way to get in touch with us urgently is to call us, actually. And so you'll always find the phone number for your doctor's office right at the top of your ABS, the after visit summary. And so you can always call that number and it will connect you. There's usually an option when you call the number. One option is for scheduling, which will send you to our scheduling team. And there's oftentimes an option for a more urgent medical question that's available as well. I would just add too that that those are the best ways to get in touch with your doctors, is either through non-urgent messaging or through phone calls. But we always have urgent care available, and of course our emergency departments. And I think that's one of the real benefits to the symptom checker. And if you just want to show that again, Katie, real quick, when you click on your menu, it's a little confusing. There's something called a symptom-specific questionnaire. That's actually not what we're talking about. That's the third option down. We're talking about this symptom checker, which is the one at the bottom here. And this is going to connect you to ADA. And when you go through that process, it's actually going to ask you a lot of questions about your medical symptoms that you're having. And then it will provide you with a specific recommendation at the end, such as, this is really urgent, go to the emergency room or urgent care immediately, or this is something you can schedule a follow-up appointment with your doctor to talk about, or things like that. So this is a really helpful tool if you're looking for more urgent advice in terms of what you should do next.
Hey, thank you. Question for you, Katie. This person is wondering, how can I edit my record and remove any old allergies, medications, etc.?
Yep. So it's important to note, well, you can request information to be removed. Any of those requests are going to go to your provider to actually validate and then do that actual updating to your medical record. I would say the best way to do that is, depending on what the information is. When we went through each check-in, you saw that you can edit your allergies at that point. You can edit your past medical history, and you can also edit your medications. So that's really the best way to do it, because then you have an upcoming visit. When we also have your medication list here, this is, we talked a little bit about this. You can request a refill from here, and then you can also choose to remove the medication from there if you're no longer taking it. Again, I will just say it does not delete it from your medical record. It does then send it for the next time you have an in-person or telehealth visit, that information will be reviewed with the clinical staff, and they'll confirm that indeed you're no longer taking it and you need to have it removed.
Yeah, and I would just mention, to echo what Katie said, I hear this a lot from my patients. Hey, I removed a bunch of stuff. Why is it still there? And it does actually require action on our part to confirm those removals. And so there's really no harm in you politely reminding either the medical assistant or the nurse or the doctor, whoever is interacting with you, hey, I cleaned up a lot of those things out of my med list. Can you just remove those? And that may be a gentle nudge to remind them to do it. We're all very busy. We're running through our day. We're writing these big long notes. We're refilling your meds. We're doing all these other things. And sometimes we forget to clean some of those things up out of your medication list. So if you find yourself doing a lot of work cleaning this stuff up and it's not actually being removed, you can just, politely nudge your provider or their staff when you're in the office to ask them to do that.
Okay, thanks for that reminder. And Dr. Babula, another question here for you, a little bit more of a specific case question. What if your after visit summaries are missing? How do you get someone to address this issue or fix it?
That's a great question. So I think that would be a very good use for the customer service request feature. So if you want to show that again, Katie, you go to you go back to your inbox, you click on send a message, and then you would click on ask a customer service question. And so this would be a great thing to ask a customer service question, because this is not going to go directly to your doctor's office. This is going to go to the customer support team that can help investigate that for you. There's a lot of reasons you might not have after visit summaries. It might be related to certain types of encounters actually don't have after visit summaries. They're most commonly associated with office visits and telemedicine visits. So you may find that some other types of encounters don't have an after visit summary for various different reasons, or maybe if it's really old or something, it wasn't printed at that time. But if you submit a customer service request and put in that customer service request the specific visits that you're referring to, like put the dates and the visit type in there, someone should be able to investigate that for you.
Hey, great. And a quick follow-up question for you here. Do cancellations, new open time slots with physicians get regularly shown on the MyJeffersonHealth scheduling section? Or this person is wondering, do I need to call my doctor's office to find out about cancellations or new open slots?
Want to answer that, Katie?
I'll take that. Yeah. So they do show up. I will say there are some nuances to, depending on when the scheduling was. I would say the best thing to do is to sign up for the wait list. So when you're scheduling an appointment, let me just go ahead and get to scheduling an appointment. There is actually a little button at the bottom when you're scheduling a new appointment that says, do you want to be put on the wait list? I would always recommend doing that, especially if you're seeing someone that has limited availability. The reason for that is we have functionality called Fast Pass, that if a slot does open up and it's a new patient visit and you're a new patient visit, you'll actually be pushed, if you have your notifications turned on, an offer. And so we'll say, hey, Dr. Babula has a slot open on Friday at 2 p.m. that looks sooner than your current appointment. Would you like to take it? And so you do have that ability. That is what the wait list does, is it then opens you up to receive those offers. And so that is probably the best way to go about that. And just to give you volumes, because I know people are like, oh, that doesn't happen that much. Across Jefferson Health, we are a huge health system, but we do, sometimes upwards of about 6,000 of those offers a month. Sometimes we're down around 3,000 or 4,000 because people don't cancel, but there is a large volume of patients that do get in sooner by using that functionality.
Okay. Yeah, that's great to know that waitlist function. Thank you. A follow-up question for you, Katie. This is about mobile versus desktop. And let me see this here. Are there functions that are different, not available when using the MyJeffersonHealth on mobile versus desktop, or are all functions available both ways?
That is a great question. I would say more often than not, most things are available on both the mobile and the desktop. With the caveat, the biggest thing is printing. The mobile app, even if you have a Bluetooth printer hooked up to your phone, you will not be able to print most things. You don't get the little print button that I showed in the top right-hand corner. Especially if this happens if your physician's sending you a back to work letter and you need to print that to give that to your employer, you will need to do that from your desktop computer.
Okay. Well, thank you. And a quick question here for you, Dr. Babula. Are reminders for screenings I am due for shown in MyJeffersonHealth?
Yes, they absolutely are. So I believe if you go to your menu, it will probably be under something called, well, actually, yes. So it may be on the home page. If you're actively due for something, it'll actually pop up on your homepage. So I did notice the last time I logged into MyChart a couple of days ago, it told me I was due for my flu shot, which I'm planning to get like next week. So I haven't gotten that yet. So it says my flu shot is due. But yes, your colonoscopy, mammograms, various other vaccines will pop up there. If you're interested in reviewing them, you can go to your menu, and then it's preventative care, I believe, right?
Yes.
And this will actually show you all of your preventative care gaps. So if you're, due for shingles vaccines or COVID vaccines or flu shots or your annual preventative visit, et cetera, you will show it here, and it will actually tell you when you will be due for it next. This patient is our test patient and is overdue for everything. But if you weren't yet overdue for something, it would tell you you're going to be due for this in a couple of months.
Okay. Our test patient, not the best example, but
Oh, exactly. Yes.
certainly a helpful feature. Great. Okay. Katie, a question again for you about payment. If you have a question about your bill after an office visit, can this be addressed within the patient portal, or should this be done another way?
Yeah, that's actually another great option for that non-clinical message request that we spoke about. So here, if you have a question about billing, and you actually go ahead and click the billing option and put in, what date of service or what appointment you have a question about and what exactly your question is, that actually gets routed directly to our central billing office, and someone will either call you back or they have the option to go respond to you directly in MyJeffersonHealth. So I'd also put in there, if you have a preference for whether or not to communicate through the portal or to receive a phone call back, put that in there, but you absolutely can ask those questions.
Okay, great.
And I did see one other thing on the billing in here. There was a question. It was actually a comment in the questions about the fact that when you pay your copay in advance, which Katie showed how you can pay your bill. You also saw how you could pay your copay in real time during each check-in. If you pay your copay there, your credit card will not actually get charged until you arrive for your appointment. So you don't have to worry that you're going to get charged days ahead of time or something like that. Or if you cancel the appointment, you won't get charged. It's mostly just to save you that extra step when you get to the doctor's office, so you don't have to wait in line for that.
Okay, that's a great call out. Thank you. All right. I know we'll just be wrapping up here shortly, but we've been receiving a ton of great questions. So thank you all for submitting them. Just a few more questions here, and actually two here about privacy. So Katie, a question for you. What measures are taken to ensure patient privacy, digital security in the patient portal?
Yeah, that is a great question and something we talk a lot about. So our website is encrypted. We do a lot of information when it comes to verifying you are who you are. When we set up your account, we actually go through a third-party verification system, similar to if you were applying for a new credit card or something like that. We also have proactive audits that we do of the system to make sure we don't have any, we call them bad actors. So we work with our cybersecurity team to make sure no one is trying to break into our account or into our system. Along those lines. So I will say we work very closely with our privacy officers. I actually have a weekly meeting with them to discuss if there's any issues, if there's any concerns. And we do have the proactive kind of testing of the system by our cybersecurity team. So they're an active part of our team here.
Okay, great. And as a follow-up, this person is wondering here, is two-factor authentication available? And if yes, how do I set this up?
Yep. So it is set up by default. You might have turned it off, and that is, or you might have, started your account before we did turn that on. If you go to your menu sorry, I right-clicked. Trying to do too many things at once. You go down to your account settings and security settings. You do have the ability to turn on two-step verification, and your options are either via text message or via email for your two-factor authentication.
Okay, thank you. Terrific. And thank you all for the live questions. I think we got through them all here. Any other final remarks that you'd like to make just based on these live questions coming in? I know that you've been keeping an eye on the chat as well, so appreciate it here.
Yeah, I think there's another question in here about multiple providers using MyChart, who on our side is responsible for syncing info across the system. So I'm not sure if you're asking about information within the Jefferson system versus information across multiple systems, but information across the Jefferson system, there is only one set of information. So whether you see primary care or gastroenterology or cardiology in the Jefferson system, we all share the same medical records. So that problem list that you can view is the same problem list that I see. The medication list that you can view is the same medication list that I see. So part of the benefit of having this large medical record system that crosses the vast majority of our hospital systems at Jefferson is that it allows us to all share the same record. If your question is about when you have multiple providers across multiple versions of MyChart, that does get a little more complicated. There's something called Care Everywhere that allows us to kind of reconcile that information as it comes back and forth. And oftentimes you'll find your primary care provider is the one who is kind of reconciling that information back and forth so that, the one record is consistent.
Okay. Well, thank you. And thank you all again for the live questions. I know I learned a ton this evening, so I appreciate it. But thank you again, Katie and Dr. Babula, for your time this evening as we wrap up tonight's discussion. A lot of great information was shared about how to use this incredibly helpful platform. And again, thank you all for attending and submitting your questions. We will be posting an event survey, so you can let us know your thoughts. Was this helpful? Are there any other specialties you would like to hear from? Your feedback will bring more virtual events like this to you, the patients. And if you'd like someone to contact you directly to schedule an appointment with a Jefferson Health provider, please fill out the last question in the event survey. We do have more wellness webinars coming up soon. If any topic is of interest to you, be sure to sign up. A recording of this event will also be sent to you so you can rewatch at your convenience. And if you would like to view other wellness webinar series events, please visit our Jefferson Health YouTube channel at youtube.com/Jefferson Hospital. We have topics covering everything from back and neck pain to robotic surgery to planning for pregnancy and much more. If there is anything anyone here at Jefferson can do for you, please reach out to us. Thank you once again for joining, and please be sure to stay safe and healthy. Thank you and have a great night.